Are we all ready? Okay, all right, thank you. Thank you. All right, so good evening and welcome everybody. I'm Councillor Saya Raza, Chair of Overview and Scrutiny Committee. It's now just gone 7 p.m. and I would like to welcome everybody to this meeting of the committee, my fellow scrutineers, cabinet members and officers of the council and members of the public who are present with us at Hounslow House or watching the committee on the council's YouTube channel. Before we begin tonight's substantive committee business, I want to pause for a moment to note the death earlier this month of Councillor Jagdish Sharma, MBE, Councillor for Hounslow West, and Councillor Junior Mia, Deputy Mayor, Councillor for Hounslow East, and recent member of this committee. Councillor Sharma was a member of this council for over 50 years. Having been first elected in 1974, he was the only member of the council to serve as a mayor, deputy leader, and leader of opposition at different points during his lengthy career and tenure. Councillor Mia became a councillor in 2022. He acted as my vice chair in 24-25 and also served on the council's housing and environment scrutiny panel, as well as a range of other municipal duties. I am sure those of us who sat alongside him will have their own memories of Councillor Mia. I particularly recall his enthusiasm as we spent time in the communities we served during our neighbourhood enforcement scrutiny in the day last April. I would now like to ask members of the committee, our guests and officers, to join me in taking a moment to note the passing of Jagdish and Juno, please, if we can all stand up. Thank you very much, everybody. Okay, so returning to business of the committee, our agenda today sees us looking at two substantive topics. We will consider the council's emergency planning and resilience preparedness before receiving recommendations from our three scrutiny panels. In addition, we have several shorter items on our agenda. They are key performance indicators and resident participation from the Council's Resident Experience Service. An update from Councillor Sharma on the work of Joint Health Overview and Scrutiny Committee. A chance to make suggestions for topics to be considered for inclusion in the committee for 2026-27 work programme. A review of Council's forward plan and any urgent business should there be any. Having walked through the contents of today's committee, I'll now take a few moments for the last time this municipal year to set out the mechanics of the meeting. As chair, I'll run the meeting and invite people to speak, I hope by combining question and observations to our fluid discussion. I shall invite our guests to introduce their reports. I will then invite members of the committee to ask questions of our guests. I or Councillor Mosley, my vice chair, shall then speak last and then briefly sum up the discussion and advise of any issues on common ground to note. Every member of the committee who wishes to speak will have the opportunity to speak. Please be mindful to your fellow committee members and our guests and ensure your contributions are pertinent and help us framing a meaningful recommendation. Having set out the way in which I will chair this meeting, shall we begin? For the benefits of our guests and those who may be watching us online this evening, would my fellow committee members like to introduce themselves?
Councillor Max Mosley, Brentford East.
Councillor Marina Sharma, Brentford East.
Councillor Alan Mitchell, Feltham West.
Councillor Emma Yates, Brentford West.
Councillor Hira Dillon, Cranford.
And Councillor Jack Emsley, Chiswick Homefields.
Councillor Adesh Farman, Bedford.
Councillor Mohammed Umair, Hounslow West.
Wonderful, thank you, committee members. So we now move on to agenda item number 1. Apologies for absence, declaration of interest and other communications from members. I have received apologies from Councillor Sidhu. Are there any apologies or committee members wish to communicate for today's agenda? No, thank you very much. Okay, so we then move on to agenda item number 2. We have before us the minutes of our 26th of January meeting. Does anyone have issues of accuracy? If so, then please let me know. Otherwise, we'll agree the minutes now. Agree? Thank you. Yeah, that is all agreed. Moving on to agenda item number 3, and of course, the first substantive item. So residents' experience, key performance indicators and resident participation. We now move to the first of our substantive item of the evening, an update on the performance metrics that inform the work of the Council's resident experience function. It is crucial that the Council is not only available to the residents we serve, but also that it can effectively provide the right type of help and support. For some time, we as a committee have been keen to understand the function performs. Tonight, we asked to review the key performance indicators, or KPIs, and new targets which will enable continuous service improvements, enhance digital access, and ensure data-driven decision-making is optimized service delivery and resident experience. Comment on the progress of service through the review of existing surveys and implementing of the new systems to encourage feedback to learn and improve services and input to inform future plans. I would like to welcome Councillor Peter McGilwell, Cabinet Member for Community Safety, Customer Experience Enforcement, Eddie Brooks, Director of Communities, Lynn Warden, Head of Resident Experience and Improvements. Thank you all for being here this evening. Would you please like to introduce your report? Thank you.
Thank you, Chair. Good evening, members. Thank you for inviting us back to the Overview and Scrutiny Committee to give an update on progress that has been made since April last. Firstly, we have completed work on our KPIs to ensure that what we report on gives us the insight we need to understand the experience we provide to residents and how we can improve this. We also assign targets to the KPIs where this is possible. As part of the governance for this area, a resident experience were audited in December. The purpose of this internal audit was to review performance management processes in the service, which I'm pleased to say noted a sound system of governance. As part of our continuous improvement processes, we collect resident feedback on our website and for our contact center. We review this feedback and use this to improve the service we provide. We also came to make sure our surveys are designed to maximize participation. That's why last summer, we improved the method for the contact center survey to be more seamless, and we now see a high number of responses for this survey. The resident portal is a key tool to us delivering a good experience to residents. I'm happy to say that the portal called My Hounslow came online in December 25. My Hounslow brings together high demand services which will help to provide a more simple and joined up portal for residents. Different elements of My Hounslow will be introduced in the phases. The current version resident can track, on the current version, the resident can track, return to their submission forms, and easily access local information. I look forward to the next version of the portal, which will be introduced, way to resident to subscribe to update when signing up to the portal, which will be a key for improving how we communicate with residents to deliver a positive experience for them. We welcome questions. I have Elliot Brooks, the Director of Communities, and Lana Warden, Head of Services with me. Thank you.
Thank you, Councillor. Forgive me, Lena Warden. Yes, I've got that right. Thank you very much. Yeah, just correcting that. Yeah. Any sort of questions? Councillor Farmer.
Councillor Pritam Garewal, I have two questions for you. How is the feedback collected in the contact center? And second question, what can be done to improve survey uptake in the contact center? Thank you.
Thank you for your question, Councillor. Yes, we collect information by survey. We sent SMSs on the following week on Monday, and people have the choice if they want to opt out. They don't want to be part of that, they can opt out of that. And the second question was how to improve? Okay, at the moment, we are doing, sending the SMS, sorry, on the following Monday at 1 o'clock. I suppose we can look into different days and different timings, or even the option of automating, like we can send it as soon as the person calls, we can send them the survey at the same time. So that's the option we're looking at. Yep.
Councillor Emsley first. Yeah.
Thanks, Chair. Just a couple from me, Councillor Garewal.
Mhm.
So 4.2 of the report lists some examples of resident experience KPIs. That's not all of them, though, is it? There are other KPIs.
Yeah, these are the main ones.
Okay.
There are some more KPIs.
Great. So almost a year ago to the day, your department came to us with a new set of KPIs that you were going to be focused on.
Mhm.
At the time, targets hadn't been developed for those, but what they did say is they were going to track for data against those KPIs between then and I guess now, and then use those to inform targets. Could you just update us on to like the performance against those KPIs that were presented to us a year ago, and if they're all still in place or if they've been tweaked?
What are the KPIs?
Do you want me to?
Yeah, I can, yeah.
So,
Yeah. But there were some KPIs, new KPIs you're talking about?
Yeah, so the new KPIs were first presented to us a year ago.
Okay, yeah, some KPIs, we're still collecting data for them. And they are not shown there yet because we haven't got enough data for them. And the other ones is,
these were four that were in place last year.
I didn't see the report, sorry. Can you do that, please?
Yes, certainly.
I didn't see that report.
Happy to answer. So, yeah, so of the performance indicators that came to the last meeting, so the average waiting time for web chat is one that we added a target to,
Yeah.
and we have met the target throughout the year for that. The percentage of contact centre calls answered from sort of April until sort of early sort of autumn, we continue to meet those targets. Unfortunately, winter has seen sort of demands through particular phone lines, that has meant we then dipped below sort of target for that. But we're seeing an increase already to sort of head up towards sort of where we should be sort of going forwards. And we've also, the response times, we've sort of tweaked that slightly as well. So again, a similar thing, we sort of met the target to start with. And then as we've then had sort of staff issues in relation to just retention and and high sickness levels, as well as busy winter period in relation to phone calls. But I mean, that's been really useful because it's told us a little bit about how we need to sort of manage some of the different call queues, because some of our call queues, we've met targets throughout the whole year, whereas the repairs phone line, for example, and the housing management phone line have continued to be busy. So it's made us kind of reevaluate sort of how we sort of resource the teams and how we sort of cross-train to make sure that we can then cover throughout really busy periods.
Just to add on quickly, we're looking into other options as well. Like, for example, Monday mornings are quite busy, and so is lunchtime. So our staff is looking into going for lunch for different timings. And we are also thinking of, sometimes we can call you back. Some companies are doing it. So we are also looking at possibility of you don't lose your place, we'll call you back.
Yeah, I think dynamic staffing is a really, really smart move. And one of the KPIs that came before us last year that I was quite interested in the progress on was the percentage of cases completed within an SLA target. There wasn't a target for that last year. Is there a target for that now, and how are we doing relative to that target?
So we've unfortunately still not been able to set a target for that as yet, mainly because the information, the sort of the certainty of the information that we're getting back in relation to how the systems are working to give us that data. As you can imagine, that it's then sort of tracking through to sort of passing it over to different services and then getting the feedback that the services have then completed sort of the targets that are expected of them. So at the moment, we haven't set targets for that, but we're hoping that that's something that we're still going to be focusing on. And as more services are going through the Transforming Community Experience programme, we're able to then hopefully collect some of that data through sort of the new systems that we're just introducing at the moment.
Makes sense. Can I steal one more question? Thank you, Chair. And this is the last question about last year. I also appreciate, Councillor Gerald, you weren't in this position last year, so this is a bit unfair on you. One of our recommendations at the end of that discussion was a request on an update about how the new CRM system was impacting the number of residents coming forward.
Okay, sorry, say that again.
How the new CRM system was helping to impact the level of engagement for residents. So I just wondered, you said there'd been quite a high level of responses. Can we ask what that is as a percentage? And secondly, how has it increased since the implementation of that new CRM?
So it's actually it's 2% of so for the calls we're receiving, it's on average about 2% of responses we're getting back at the moment from the text messages that we're sending out. That's not, we want that to be much higher, because then that would give us much more evidence and information to help us shape our services and to improve. So we're very much kind of focusing on how we can improve that. And as Councillor Grell mentioned earlier, looking at different ways that we can collect some of that data sort of through the system. And the system should do things like automate that survey to go out straight away. So while we then capture, hopefully, people immediately to provide that early response to us.
Is that higher or lower than when the previous CRM was in place?
I'm not sure, to be honest. We can find out and provide that.
Thank you for that. Is there Councillor May, please?
Thanks, Chair. Councillor Giro, I just want to confirm the targets that we're aiming for in the KPIs. Is there a reason you're targeting 85% or 90% as opposed to, let's say, 100%, which may not be achievable, but is this based on some sort of a matrix where you assume that 85% is a good number based on some data, or what's this based on?
Yep, there are some complex issues sometimes, and targets, people are trying to do as many we can, but 85% is improvement from the last one, and stopping issues was there. Now we have a full team, and hopefully that number will be improved soon. Anything else?
Yeah, I mean, we'd love to have 100% as the target, but we need to challenge ourselves and be ambitious. But I think we also need to be realistic as well about what we can collect and what we can deliver. So we've been benchmarking and trying to consider what other local authorities do, so that we can then sort of be sort of on par with them. And then also looking at the sort of the previous data that we've got in relation to calls and what changes we can make. So the intention is that's where we are at the moment. That's an ambitious target for us to meet right now. But we will continue to review the targets that we've got in place and hopefully be able to increase those as performance sort of increases within the service.
Another one. In terms of on the risks where you specify data, I think an issue with or inconsistencies with the data collection, is there something, I mean, I know you've identified in the report the causes and the reasons behind it. Is there potential, let's say, resolution for future data collection to avoid the same risks?
Yeah, so one of the things that we have been doing is refining the wording that we're using for questions. So as the contact centre, we want to get feedback about the resident experience team. So how did we handle your call today? How effectively did we listen? Were we able to kind of answer your queries sort of first time? And as you can imagine, when residents phone often, they want to talk about a particular service and the reason they're phoning. So sometimes we find that the feedback isn't about us as resident experience, but it's about another service within the council. So that's where that kind of potential inconsistency comes in, where we see sort of lower kind of feedback results, but it's not aimed at us, it's aimed at the frustration that something hasn't been done elsewhere. So we want to be able to kind of be really clear about where the feedback needs to be, how we need to learn from that feedback, so we can then change the particular areas that residents sort of want us to improve on. So whether that's call handling or whether that's the service and being able to kind of be right first time and make sure that we're communicating effectively with residents. So that's what we mean by kind of some of those inconsistencies.
Thank you for that. I mean, just a couple of questions from me. I mean, would you say resident participation has increased with the new digital inclusion offer?
Yes, definitely has been, especially with our library and hubs. And people can go to their nearest library and get all the information there. And all our staffs are trained for preventive training. And yes, it has improved, especially in the contact center as well. We have a full staff now. And what they do is, like Lina is there as a manager, they look at the queues, and if they see one queue is very heavy, they can move into the next one. So yes, there is an improvement.
And the other sort of question for me is that, yes, we're getting sort of a lot of data, which is great. Data is always good. Would there be in the future where we will have some form of tangible targets that we're working towards?
Sorry.
Yeah, definitely. I mean, any feedback that we get is really helpful because it helps us shape our services. It helps us really listen to our residents and understand what challenges they're experiencing and what we can provide and do as their local authority to help meet those. So it doesn't just tell us, you know, when we do surveys, when we kind of listen to calls, it doesn't just tell us about sort of a particular kind of performance indicator. It also tells us about what we could be doing differently as a wider service. So we really do listen to kind of, you know, the feedback that we get. Things on the website, for example, is really helpful as well, because we can then make some quick changes on the website to increase that satisfaction. So it's important for us to kind of use all channels that we've got to kind of collect as much feedback from those residents as possible. And then that will then help us sort of shape what future performance indicators we might want to set, and what targets we think are appropriate to continue to kind of push ourselves forward.
Brilliant, thank you. Any other questions? Yep, Councillor.
Can I just ask a clarifying question, leading on from your question? You asked about engagement, and we were told it had gone up. Obviously, engagement with the survey hasn't. Can I just ask what we mean by engagement generally? In answer to that question.
Well, yes, engagement with the customers, but with our residents can be done on contact, like phone calls. That's what you're talking about, and the face-to-face engagement.
Well, no. So when I asked about engagement, the responses to surveys was about 2%, which we said we weren't sure whether that had gone up and down.
Yeah.
The question from the chair was, had engagement gone up? And you said yes. So I just wanted to clarify what other forms of engagement we were talking about when you were answering that question.
Well, all I can talk about is the contact center is there, and we have 100 digital champions as well now. All people are not digitally sort of comfortable with the council. So our digital champions are there to help them. They can go to the library, and they'll be trained for them, basic training for the computer. Anything you want to add on?
Yeah, I suppose I see engagement as interactions, really.
Yeah,
I suppose rather than kind of specific feedback that we're then going to use to then improve. So yeah, I think interactions is sort of, we're very much about kind of improving the digital options. Web chat, for example, is performing really well. We're finding that we can then manage that between sort of emails and other workload and things that come in. So that's how we can be quite responsive and reactive to that. But we need to make sure that we still have the online, the other channels, so the in-person channels and the telephone channels, so that we are meeting the needs of residents who don't want to do things online or can't physically access that themselves.
Makes sense. So can I just ask how many more people we are engaging with under this new system?
Don't have the exact figures to hand either.
No.
But yeah, that's something that we can definitely. So we are sort of looking at how we can kind of track sort of the online contact versus sort of telephone and in-person contact. So that, because channel shift is something that as a council we are committed to do. So we are quite keen to be able to see sort of how that sort of tracks in relation to calls that we're receiving versus online contact. So that's something that's our sort of our next plan for kind of how do we make sort of effective key performance indicators that can evidence that. Is sort of the next on our agenda of steps to take.
Mandy, yeah.
I just wanted to respond on the part about the percentage responding through the CRM, i.e. satisfaction with, and the 2%. I think we've concluded that actually in the before this system, we didn't actually have that. So it's from 0 to 2%. We didn't have a CRM of that sort to be able to collect any feedback on the interaction. So whilst 2% of that feedback feels quite low, obviously lots of people won't necessarily respond because they've got an answer, they've moved on. 2% is quite good in terms of the amount of data we're getting, but we need to accrue more over time. But in the previous system, which was a series of systems rather than GovService, we didn't collect it.
So there's no data on how many people gave feedback pre the CRM?
Pre what we had before.
You weren't asking for it?
Yeah.
Okay. So you weren't asking for feedback before the CRM?
We didn't really have a CRM.
Okay. Right. Okay.
Any other sort of questions from committee members on this? No, thank you. Okay, well, we're going to, thank you all. So we're just going to move into the debate now from within sort of committee members. So just to help discussion here and sort of form recommendations, just to remind the committee, so we're reviewing the key performance indicators and new targets, which will enable continuous service improvements, enhance digital access, and ensure data-driven decision-making to optimize service delivery and resident experience. There's two things here. Comment on the progress of the service through the review and existing surveys and implement of the new systems to encourage feedback to learn and improve services and input to inform future planning. I'll leave it to committee members. What do we think the recommendations going forward?
Go on, Chair, I'll kick off. I would quite like to see a full list of the KPIs because it sounds like there's quite a lot of data that we're collecting. So I think seeing that fully would be really useful, and the targets next to them, notwithstanding those ones that we're still building the data out for. I think also tracking how many people we are engaging with is a really effective way of seeing just how effective our engagement is, and also if we need to tweak anything in any particular areas. So any data that's collected around that, I think, would be really useful. And if that could be reported back to us, I think that would help us to then make some recommendations on areas where things are working really well, and also where things need to improve.
Yeah, thank you for that, Councillor. Any other sort of recommendations or discussions with this? Just following on from you, Councillor MC. So I think we got sort of KPIs, yes, and I think we do. Just to confirm, and I just want to confirm this point. Do we have like a good, satisfactory, bad, poor sort of survey?
Yes, yeah, we have one for the website and one for telephone calls. So we ask a variety of kind of more specific questions, but then we have an overall kind of satisfied, not thus very not satisfied, sort of like 3 smiley face kind of ratings, effectively, like that you see on the website.
So it's kind of like a RAG rating, or yeah, is it
Yes.
okay?
Yeah.
Yeah, I mean, it'd be nice, mate. Okay, that's fine. Thank you for that. I think just recommendations. We've got a couple. As long as all the committee members are happy with this, so introducing tangible KPIs for 26, 27 and beyond. So really sort of, stepping on to what Councillor Emsley was saying there, separating measures as well to better understand. So we've got the KPIs as percentage, maybe good, bad, RAG rating, something like that, so we can understand what a resident perception is of the borough. Because ultimately we just want a really good outcome for our residents. And sharing the full list of performance measures with OSC in future OSC meetings. Yeah, is that okay? Yeah. Committee members all happy with recommendations? Just a seconder to the recommendations. Thank you, Councillor, and just a vote on the recommendations. Thank you all very much for that. Councillor Gilroy, Elliot, Lena, thank you all very much for being here. You're more than welcome to stay if you wish. I'm sure you don't, but yes, we do. We do sort of move on to the next agenda item. No problem at all. We give a few minutes. Wonderful. After the little chair shuffling, we're there. So, agenda item number 4, we move on to the second part here. So, emergency planning and resilience preparedness. Emergency planning and resilience are fundamental to protecting our communities when something goes wrong. A flood, a cyber attack, civil unrest, or major incident, residents look to their councils first. After all, when push comes to shove, councils are part of the state that is closest to the people. Strong preparedness ensures we have respond effectively, safeguard the vulnerable, and help communities recover quickly. Whilst the Civil Contingencies Act places a statutory duty, that means LB Hounslow must ensure arrangements are in place for emergency planning, response, and recovery. I would like to think that residents can look to the council for assistance. The committee has the opportunity this evening to comment on the current approach and highlight areas where we consider focus would be beneficial to the council. I'm sure members of the OSC have a useful contribution to make. Councillor Shantanu Rajbhat, leader of the council and portfolio holder for strategy, resource and external affairs, is the regular guest on OSC. This time he is here to update us on the council's approach to resilience and to listen to our suggestions. He is joined this evening by Mark Lumley, Director of Digital IT and Resilience. Welcome to you both. And of course, you have the floor. And forgive me, I do also have Tim Arnold here, Head of Resilience as well. There we are.
Chair, thank you very much. In time-honoured sense, I knew you were going to say all of that stuff, so I'm not going to say any of that as part of my introduction. Really good to be here, Chair Committee. Thank you for having us. I'll forgo the introductions, really want to get into the discussion. Mark and I will sort of double hat this a little bit. Just to bring out a couple of highlights from this report. So it is an update on last year's activity, both within the organisation across various departments, but also with work with our partners, schools and others. It highlights our robust resilience arrangements and our approach to emergency planning and our capabilities to respond to incidents. It shows that we have really robust arrangements around resilience, and our approach very much is resilience is everyone's business. And that's how we work for planning and responding to emergencies. It gives an overview of our resilience standards self-assessment. So the paper itself shows that we have self-assessed ourselves as having established 10 out of 11 resilience standards for London, which is a cross-London agreed set of benchmarking standards against core resilience-related activities. The one that is working towards established, but you'll see in the report isn't quite there yet, is our community resilience score. That is on track to being established status. As we know, we've got very strong faith, voluntary and business communities, which have been often in past emergencies very quick to support communities affected by incidents. This year, the GLA has provided funding to community groups to strengthen their understanding of emergencies and resilience, and we're working with these projects to formalise how we best work together during emergencies, which will also improve our self-assessment score on community resilience, and also tying into some of the comments made in the corporate peer review as well around our work with communities as well. This is a key part of that. We often talk about elected members. Well, the report does outline the role of elected members and how we ensure that elected members are trained and understand their responsibilities in emergencies. That's not just myself as a leader and Tom as deputy, but also the cabinet and those on the backbenches and the opposition as well. We're an organisation that wants to continually learn from incidents and update, and the update outlines how we do that. Hounslow has and always will have a commitment to learning lessons from incidents, and the report outlines how we undertake some of this work. We're pleased, therefore, that the government is progressing the Public Office Accountability Bill. This will require authorities to act with candour, transparency and frankness in response to inquiries and investigations, and requires public organisations to maintain ethical conduct and work in the public interest. And finally, just to draw out something that I'm quite proud of in this area, at the last Cabinet, you may be aware, we formally adopted the Charter for Bereaved Families bereaved through public tragedy. As outlined in the report, to ensure that pain and suffering of families affected by the Hillsborough tragedy is not repeated in the future, and to align ourselves with the future requirements of the Public Office Accountability Bill. I'll now hand over to Mark.
Thank you, Councillor. I'm just going to add a couple of things to that are in the slides that are in the report. So within the framework that we have, we've got different levels of the framework and the sort of accountability within that. So at the sort of local organisational level, at the borough level, but we also play a part in the sort of pan-London arrangements as well. And we all have a sort of role to play in that. This is also sort of very real for the borough as well. So whilst there are plans for sort of every eventuality, and some of them are pan-London plans as well, we very much keep this sort of alive within the organisation and the borough. So we track and monitor the number of officers that we have on gold and silver and rest centre managers and LALOs and so on. We make sure we have sort of suitable numbers to stand up immediately in an incident, but also thinking about sort of longevity of an incident as well. And we also have, which is on slide sort of page 33 in the report, a sort of robust training and exercising plan, with an aim of really trying to bring that to life in a sort of practical and pragmatic way. So slide page 33 there gives a bit of a overview of some of the training and exercises that we've done in the borough, in the organisation in the last few years. The most recent one being a multi-agency exercise, which again, reflecting on the leader's comment about our partners, and that was a really important part of that, not just blue light responders, but some of our agencies and partners that will be there in the recovery phase as well. So I think that's all I was going to add.
Thank you, Mark. Yeah, okay, thank you. So yeah, we moved to the discussion or questioning to the report that you just heard. One of the sort of questions that I was going to raise, Councillor Leader, you already kind of almost mentioned it. So the question is that what is stopping us that sort of community resilience from development to be established? So what is that sort of the missing piece, so to speak?
So I think there's been a lot of work trying to map what that community resilience looks like. And we have to acknowledge by its very nature, it sort of shifts and changes depending on what the scenario is. So we found, during a national crisis like COVID, actually a lot of groups came forward, a lot that we knew, but also you're finding that people were clumping together and forming sort of informal groups as well. And that's also fine. They're offering their support. It's how can we support that activity to sort of happen. I think there is that little bit about, going back to the corporate peer review challenge, report around community resilience more generally. And having that resilience within the system so that not only is there that business as usual and that support and advocacy that exists every day, but how that steps up when you've got an emergency situation, and how there's that clarity between the role of us as the council and those organisations so that we're not either duplicating or not helping one another. I don't know whether there are any reflections from either of you two that would add to that.
So I agree with that. I think the only other thing I'd add to that is we want this to be sort of self-sustaining in the community as well. So there's and that's something that we've done a lot of work in through the Hounslow Resilience Forum as well. So it's more of that and the coming together through multi-agencies and so on. So that's the sort of aim of that. The ambition is to make it a self-sustaining activity.
Brilliant, thank you for that. And the other sort of question, I guess, for me is going through the report. If there was a scenario, an issue, it takes 48 hours for command to come up and running. Is there any particular reason why it takes so long?
Sorry, so just to clarify, it doesn't take 48 hours to stand up command at all. The requirement of us as a local authority in London is to have resources to maintain an emergency for 48 hours before we ask for mutual aid from other boroughs. So that's still 48 hours. So we need to be self-sustaining for 48 hours. We definitely are through our established command and control arrangements with gold, silver and bronze, which is stood up straight away as soon as we're notified of an incident. So yes, we don't wait 48 hours, I assure you.
Thank you for that clarification. Any other? Yep, there we go. So I'm going to take, just simply because Councillor Helmsley put his hand up first. So Councillor Helmsley, go for it.
It's too quick. Sorry, team. Two quick ones from me. Just the first one about communications. Really, really important during an incident. I just wondered how closely does the resilience team work with the communications team at the council? And also, how does the council work with communications teams from partner organisations during an incident?
So very, very closely. I think as part of that gold arrangement, that command and control. Is it command and control? Is that what we call it? Yeah. Command and control arrangement. Obviously, gold sits at the top, and that filters down to silver. And I think on silver, there is someone from comms. Is it silver? On every level, there's someone from comms. And in terms of the relationship with partner organisations, obviously, if there's statutory organisation, we've got contacts directly in, and sometimes it's about our comms sort of taking a step back and letting those organisations come forward, and vice versa. So they're very well established, and actually as part of that training that Mark kind of talked about, we kind of look at how that can be as strong as possible, because we absolutely appreciate that that's the first thing that people want to know about is what on earth is going on.
Great, and then I'll dive in with just another one. I actually was lucky enough to meet Figan Murray last week, who's obviously the mum of Martin Hett, the person whose Martin's Law is named after. That's in the implementation period at the moment. How do you feel that's going? And do you feel that within, it's probably about 12 months now, isn't it, the end of the implementation period, we'll be in a position where we'll be able to fully implement Martin's Law in Hounslow?
Yep, so as soon as that moved through, in fact, before that moved through the comments, we went to corporate leadership team to establish a sort of governance approach around how we're going to implement Martin's Law, which established a working group. So far, that working group has established not only what council premises are within the tiers of Martin's Law, so Martin's Law effectively dictates what counter-terrorism planning arrangements are required for different sized venues with public spaces. So we've established that internally, but also we've been developing guidance for organisations as well. There is a bit of a catch-22 with this as well, in that government hasn't released guidance, so you don't want to go too far in terms of supporting organisations. However, there is some clear business as usual counter-terrorism advice and guidance that we signpost community groups to, etc., as well as making sure that we in the council have got robust training arrangements for frontline staff. So we're working closely with Met colleagues and our community partnerships team to just make sure that that is all in place. And to be honest, it's nothing really new. We do it already. It's just formalising it and making it legislative. So I think we're in a good place.
Thank you, Councillor Mayor.
Yeah, I think it's good that we've got, aside from the one that Chair mentioned, where we are in terms of communities where we don't have established, established standards in terms of the London standards, that 11 that I expected. How about in terms of where I mean, it's good that we don't have as many instances throughout the year or so for us to rehearse those, or let's say put those standards to a practice in a regular, let's say consistent form. How do we, let's say, stand, or as part of our trainings, do we monitor or ever look at lessons learned, or let's say, ideally lessons learned, or what other boroughs have done in London to see how well we could, let's say, if we do caught up, let's say, in a massive flood or whatever, or a massive cyber attack, how do they deal with it, and what are the lessons learned, and how are established standards compared with those?
Start, if that's okay. So I think so we do a range of that sort of training and exercises on a range of different topics, and they are mandatory for officers in the council as well. So making sure that we have that spread of different activities. You say a flood is very different from a cyber attack, but even from the 75, I think it is in the report, sort of actual incidents we've had in the borough, we make sure that we've got very robust arrangements for that learning and reviewing, and making sure that we then review that into our plans and doing things differently. The other thing I was going to add to that is that we are part of that London arrangements. I'm currently the chair of the West London Resilience Board. So from a regional level, we're having those conversations and learning lessons, not just within the organisation, but within the region and across London as well. So last week there was the Director Resilience Conference as well. Again, an opportunity to share reflections and what others have been doing. So I think we're very good at that lessons learned within the borough, but also make sure we do look out into the region and across London as well.
Thank you. Councillor Mosley.
Just wanted to talk a bit more about the financial implications of being prepared for emergencies. I noticed that 0.2% of the annual budget has to be, I believe, earmarked for emergencies. Could you just clarify, of the 75 situations that we've had of the last year, do you know roughly where that takes us up to in terms of that annual budget? Is it something that we're routinely coming up against, or is there a bit of headspace rather?
So 0.2% of the council budget is actually quite high, so we're nowhere near those Bellwin thresholds. What I would say is Bellwin isn't the only mechanism of what shall I say, raising funding concerns with government. So if there was an emergency that resulted in a lot of spend, it's likely that it was quite large scale, and that sort of command and control arrangements would exist across London. And then through that strategic coordination group, which overviews sort of London arrangements, you could begin to lobby government for saying that we need these resources to respond to this emergency. So it is a very basic threshold thing. And there's also, depending on the emergency, there are also different grants and things available. So there's specific ones for flooding that are lower scale, etc. So it doesn't mean we have to necessarily earmark 0.2% of the budget, but there is a contingency fund to cover some of this cost.
Councillor Mitchell.
Just a quick one. You mentioned the reference to Hillsborough, which I remember. As a youngster, many years ago, and how the people involved in that had to do the legwork in order to get redress, as we know historically. How confident are we, if we faced something of of some magnitude, whatever the circumstances, that we could facilitate a response on the right scale in the right time that involved young people and children, as that did. Is this all covered in what we've already been saying? It's just something that has occurred to me looking at this, because we live very close to the airport and things like that. Do we have that confidence, Tim?
Yeah, thanks, Councillor Mitchell. It's an important question, and I guess the answer is yes. And I suppose the evidence there is COVID. That needed us, all partner organisations, to kind of pull together, and the community to pull together as well. Of course, that's a pandemic. Your reference to the airport is an important one, because obviously the airport itself sits in Hillingdon, but most of the flight path sits in Hounslow. So there's that coordinated piece of work as well alongside Hillingdon colleagues and the airport itself. But there are already relationships there that already exist, and some of that joint working that Mark kind of talked about in terms of the West London group looks at those major instances that could cross boundaries of borough boundaries and things like that, and how we work together and how it affects different people, and also how you flex command and control structures. So it may not be us in control of the situation, but how we kind of contribute to that as well. Grenfell being a good example of that. Yeah.
Brilliant, thank you for that. Any other questions from committee members? Okay, we'll kind of move on to the recommendations then. Just a couple of points here. So note the emergency planning and resilience preparedness for the council in Appendix 1. Comment on the current approach set out in Appendix 1. Highlight any areas we consider focus will be beneficial to the council. So I think there's lots of good work already going on. I think I would just mention that already we're doing really, really well. We've got systems in place. We've got some of that data from COVID issues, so it's working. And just really to kind of continue with that, and just the change is always different. We're going to have sort of cyber attacks now, and you'll probably mold yourself and change yourself with local and national security issues. I'm guessing. Yeah. Okay. Cool. All right. Just a couple of bits really. So continue focusing on learning from experience across London. So just really, getting best practices, across all of London, or indeed nationally as well. And continue commitment to keeping boroughs safe. I mean, that's the number one thing here. So we're just making sure that the borough's always safe. Unless there's any other recommendations from committee, we'll go with those. If I can have a seconder, that'd be great. Thank you very much, Councillor Mitchell. And just to the vote of those recommendations, thank you all. There we are. Good work. That's what it is. So we will. Thank you all. Tim, Mark, Councillor Rajwat as well. Thank you so much for being here. More than welcome to stay, or if you like to not stay, you can of course leave. I think no, I don't want to stay. Yeah, that's fine. No problem. Oh, thank you so much. Thank you so much. Wonderful, thank you all. Okay, so we've got to move on to agenda item number 5. So this is scrutiny panel reports 25-26. So these are the deep dive recommendations already. So again, I'll just read this all out. So we now have the opportunity to review the recommendations emerging from the work of our scrutiny panels. We receive regular updates from our panel chairs, Councillor Sidhu, of course, she's not going to be here today. We got Councillor Farmahan on the work of the Health and Adult Care Panel, and Councillor Mosley on the work of the Housing Environment Scrutiny Panel. Today, though, we are asking to review the work of the scrutiny panels and agree their recommendations. I would like to suggest that we hear from the panel chairs and then pose any questions they might have afterwards. First one is going to be actually to do with children and young people scrutiny panel deep dive. The recommendations here from Councillor Siddle. Of course, Councillor Siddle's not here today, so I will just read a bit of an introduction and then go through the recommendations on her behalf. Okay, so Councillor Siddle was going to present the work of the Children and Young People Scrutiny Panel, a deep dive and update on how the meeting with lead members, Councillor Samir Chowdhury, went earlier in March. Out of the 5 recommendations that were presented to the lead member, all were accepted. This year, the panel was made up to 8 councillors, 3 co-optee members, all of whom were parent governors. The vice chair of the panel was Councillor Alan Joseph. There's 5 recommendations. The panel recommends that the Families First implementation team assesses the effectiveness of translation services in adequately supporting families with challenging in communication with support services. That's number 2. The panel recommends that the Families First implementation team consider reviewing the comprehensiveness of referral pathways for early intervention with vulnerable families due to challenges faced by services in being adequately connected with families who most need their support. Recommendation number 3. The panel recommends that the Families First implementation team works alongside existing community groups, such as interest groups and faith groups, to raise awareness around early signs and signals of vulnerability within families. Supporting the early help is everybody's business approach. Recommendation number 4, the panel recommends that the Families First implementation team provides the evidence in the next scrutiny year around whether they have successfully targeted and supported families with very young children aged 2 years and below and adolescents displaying signs of antisocial or risky behavior. Recommendation number 5, the panel recommends that Families First implementation team assesses the effectiveness of communication and signposting, improving resident awareness of available provisions. So those are the 5 recommendations. I am going to now move to Councillor Farmahan for his panel recommendations, please.
Thank you, Chair. I am presenting the report recommended and agreed by the panel. The 2025-26 scrutiny year has been a productive and insightful one for the Health and Adult Care Scrutiny Panel. Throughout in-depth examination of the growing pressure facing adult social care, particularly the emerging need for a new model of care for the fertility, have gained a far deeper understanding of how the system must evolve to meet the needs of the aging population in Hounslow. This year's work was especially important to the panel because it highlighted both the strengths of the Council's current approach and the significant challenges ahead. We learned how rising level of fertility, increasing complexity of need, and the shift toward more people living longer with multiple long-term conditions are placing considerable strain on services. At the same time, we saw how the new model of the care encourages innovation, partnership working, and a more proactive, preventative system of support. We are particularly struck by how multiple different organizations are collaborating to deal with this serious issue for many residents. An integrated approach to fertility, one that focuses on early identification, anticipatory case care, and supporting residents to remain independent for as long as possible, is a very welcome development. We also recognize the importance of strengthening community-based provision and ensuring the workforce is equipped to deliver more personalized, flexible model of sport. Our recommendation focus on key area where there might be further improvement as the new model of care is developed and rolled out across the borough. We also emphasize the need for clear communication, workforce development, and a shared vision across the whole system. I would like to thank all our member officers, COPT partners, and providers who contributed their time for expertise to this work. The panel is particularly grateful to colleagues in adult social care whose openness and commitment made this review possible. As we look ahead to the 2026-27 municipal year, I look forward to continuing our focus on how Hounslow can strengthen support for residents who are living with frailty and those who are care for them. By working together, we can help build a care system that is fair, sustainable, and truly centered around people's needs. Thank you, Chair.
Thank you, Councillor. And if I can have Councillor Mosley as well.
Thank you, Chair. So we are the Housing and Environment Scrutiny Panel, and we have met to discuss the topic of land ownership in the borough. This is a topic that we selected due to the intersection of problems between housing and also environment, given the issues that arise from fly tipping hotspots, which happen on unadopted private land. This is something that has a tangible impact on our residents who experience what people call fly tipping hotspots, for which the root cause of those problems often comes down to obscure or unadopted private lands. Therefore, it's an important task for the council to be clear on who owns what. We learned from council officers about the systems that are in place for the council to understand land ownership across the borough, but including the complexities around those systems, in particular how quickly land ownership can change. So our understanding from today could completely change tomorrow. Mostly we heard about the database tools that are available to the council to update officers on the ownership of particular sites, but the costs that come from those tools. We learnt about the strategies that the council employs as a result of not being able to just purchase large-scale data sets, including individual searches that council officers perform on a daily basis. But then we learnt about the challenges that come from, in particular, duplication across different departments, and whether there are systems in place for the council to have a sort of more stable database of individual searches. We also learnt that this is a problem that many London boroughs are facing, and we questioned whether the GLA could provide some guidance on land ownership data. We also explored alternative models for land ownership within the context of fly tipping hotspots. One of those alternative models is resident-led stewardship, where residents could come forward and take responsibility for sites beyond the question of ownership, because that is a complicated question, but that could be a simpler quicker fix to some of these hotspot locations. And then we also just explored more general purchases of these sites against a value for money consideration for saving money from not having to clean up fly tipping hotspots against the cost of purchasing those unadopted sites. So with that in mind, we arrived at the following 4 recommendations. Number 1, introduce a land ownership update cycle for council-owned assets. Mandate update of council's asset register with GIS boundary data and management contracts to prevent discrepancies from re-emerging. Number 2, provide targeted training for staff on using ownership data, deliver training to relevant teams on Earthlight, which is the council system, and internal GIS tools, understanding ownership versus management boundaries, and correct processes for checking the land registry. Number 3, create a cross-departmental land ownership working group, establish a working group to coordinate land ownership issues across parks, planning, highways, housing, and asset management. And lastly, number 4, set up a team to design and deliver a structured model for resident-led stewardship of unadopted or privately owned fly tipping hotspots. This model should be promoted through area forums and local community groups, with a team providing support and guidance to help residents implement stewardship arrangements. Whether this is not viable, the team should assess whether purchasing the land and installing preventative measures offers a cost-effective alternative. Thank you, Chair.
Thank you, Councillor. So, I would like to just say thank you first to Councillor Rajwat, Councillor Chowdhury, Councillor Bath, as well as Stephen Forbes, for their engagements in the panels, and on all the work that you've done with the panels as well. So thank you so much for that. I'm more than happy for you to maybe just talk a little bit if you wish, or anything on the panels.
Thank you. Yeah, I'm happy to start. First, I'd actually like to thank the panel for this deep dive report on adult social care pressures. And it really does support me as a cabinet member. And I welcome that you welcome the direction of travel that we're going. So, and thank you. I enjoyed reading the report. And as always, I think I've seen some really good quality reports come out of Scrutiny, and I find it really helpful. So thank you for that. I also wanted to recognise the officers within my portfolio who are very committed and continue to be committed around health and social care integration. And as you quite rightly mentioned, the challenges that we have in adult social care. So for us to be able to be in a good place to meet the future challenges, to make sure that we are sustainable and that we are providing the best possible service for our residents, particularly around frailty, which is what you focused on, but also we're acting early, we're preventing early where we can. So as you've mentioned, I'm more than happy to accept the recommendations, which I have done. But I just wanted to, if you may allow me, Chair, just wanted to really highlight a couple of the recommendations, if that's okay, for you, just to assure you in terms of where we are going forward. So the next phase of this model of care, which is what you were looking at, is really going to be looking at the evidence base and seeing what outcomes we are getting and what the evidence is showing us, because ultimately, we would like to roll it out, but we really need to look at what the evidence is showing us, because it is very early days yet. And the second one is around workforce capacity. Obviously, when you work in an integrated, multidisciplinary way, it's a collaborative way of working. Everybody has to work together. There has to be commitment, but that allows sharing of resources as well. So that's something that we need to keep an eye on as well. So that's probably all I'm going to say, but thank you very much. Really appreciate the hard work of the panel. Thank you.
Thank you very much, Chair. Thank you for giving me the opportunity to say a few words. I think I would like to begin with thanking all the panel member and the panel chair for the work on this report, and my officers in my portfolio who are developing the Family First Partnership Program. As the panel will be aware that we are still developing this program, and the observations and recommendations of the panel will help us to create a program which results in better system to help support and protection for the families. By focusing on early intervention and through working with different services in different part of the borough, we can make sure people receive the help they need closer to their homes and before they reach crisis point. On this report, I have discussed this report in full with Councillor Sidhu, and I just want to briefly, with your permission, just want to say a few things. Just want to focus on the awareness and the signposting. We know that this program will only be successful if it reaches the residents it is designated to support. And without adequate awareness raising and signposting, the program will not be affected. So one of the things we need to do is ensuring that residents are aware of this service, what is what's on offer, and how they can access it. So to achieve this, the panel recommends that the program's implementation team works alongside interest groups and faith groups to raise awareness to early sign and indicators of vulnerability within the families. And of the provision we are offering. So as the report says, supporting early help is everybody's business, and all partners in the borough have a crucial role to play. I would like to just end by thanking once again all the panel members for this report and recommendation, which I'm really pleased to accept. Thank you.
Thank you, Councillor. Yes.
Thank you very much. I'm going to channel my best. Sue Sampson and Tom Bruce here now. Thank you for the work that the Housing Environment Panel have done. It's an important area and actually underscores part of the journey that we've been on anyway, in terms of really understanding what our assets are, where they are, and where there are land ownership issues. Of course, as Councillor Mosley kind of highlighted, that changes and can change very, very quickly. So we need to be agile to that. So it's a welcome recommendation on that, and the internal processes and the staff working together, the teams working together to really understand that. We're obviously committed to sweating all of our assets as much as we can in the next administration, because that's a need in itself, but also then understanding when we get casework around land ownership issues, we can respond to that really, really quickly. I think the other part of it, in just looking at the recommendations, it underscores the digital journey as well. A lot of this is digitized, and it's digitized with third parties. So really understanding what their systems are and how they talk to our systems and how we can make that as seamless as possible and really understand the capabilities and limitations of our own systems and what we need to do in terms of our improvement. So I actually, looking at this, whilst of course Councillor Sampson and Councillor Bruce would absolutely accept it, I think there's work that crosses over into my portfolio as well, both as leader and in the digital portfolio as well. So they're very, very good recommendations. Thank you, Chair.
Thank you. Okay, so we're going to move on to the recommendations there. So members of the committee have heard from each of the panel chairs and will also have read the deep dive reports and recommendations contained within your agenda packs. Given what we've heard this evening, are we content to agree the recommendation developed by all the panels? I'm happy to propose the committee agree the recommendations. May I have a seconder? Second. Yep. Thank you. And recommendations. Vote on all the recommendations for the panels. Yeah. That's carried. Thank you very much. Wonderful. So, just to, I'd like to say, thank you to Councillor Sidhu and Farmahan and Councillor Mosley as well for your contributions over this municipal year. And for the series of recommendations that are clearly focused on making a difference to all the local people here. Do please pass on my committee's gratitude to your fellow panel members there. Okay, so we move on to agenda item number 6. This is North West London Joint Health Overview and Scrutiny Committee update. By now, I hope you're all aware that Councillor Sharma is the Council's representative on the North West London Joint Health Overview and Scrutiny Committee. Councillor Sharma, can you provide an update on your recent work of the North West London Joint Health Overview and Scrutiny Committee? Thank you.
Thank you, Chair. Yes, I can. Since our last meeting of Overview and Scrutiny Committee, there was a planned temporary move of specialist children's heart and lung and critical care inpatient services that were discussed at JOSC. And so JOSC examined the planned temporary consolidation of specialist children's cardiac, respiratory and critical care services currently delivered across Royal Brompton Hospital and Evelina London. This follows a formal clinical safety escalation regarding the sustainability of the cardiac surgical rota. So the key points were that the cardiac surgical on-call rota can no longer be sustained safely beyond April 2026 due to workforce fragility. National congenital heart disease standards require co-location of paediatric surgery with general surgery, nephrology, and gastroenterology. Yep, put my teeth back in. All available at Evelina, but not at Royal Brompton. Moving cardiac surgery necessitates the relocation of paediatric respiratory inpatients, as the Royal Brompton PICU would normally become clinically non-viable without co-located cardiac surgery. 2,500 children across northwest and southwest London and broader regions will be affected during the transition period. And NHS England has approved this temporary move, which will be implemented from May 26, with a longer-term service configuration to be consulted on separately. So with regards to Hounslow and how it impacts Hounslow is that high numbers of Hounslow families use Royal Brompton respiratory services, including for cystic fibrosis, severe asthma and long-term ventilation pathways. Representatives raised concerns about travel impacts, continuity of care and parent accommodation, with reassurances provided regarding transport, clinical team continuity and the availability of the Ronald McDonald House and on-site facilities. We also discussed cancer prevention and early diagnosis across North West London, and the committee received an update on the ongoing programme to improve cancer prevention and earlier detection across 8 North West London boroughs. The key issues discussed was a continued variation in screening uptake across boroughs and demographic groups, expansion of community-based screening initiatives and targeted outreach to undeserved populations, and system-wide preparations for new early diagnostics technology, inter-borough coordination to reduce delays in diagnostic pathways. And in relation to Hounslow, it was Hounslow has seen an increased uptake in bowel and cervical screening due to targeted outreach, but lung screening uptake remains comparatively low. The borough's diverse population and health inequality profile continue to require tailored prevention interventions and improved data insight. We also discussed at Josh the transforming of Crystal House Specialist Learning Disabilities CAMS ward. And so Josh reviewed the transformation programme for Crystal House, a specialist inpatient unit for children and young people with learning disabilities and complex needs. This service has seen very low utilisation, 23 admissions in 6 years, with only 11 from North West London. So the key points were a shift towards a new community-based model expected to support up to 40 times more children than the existing inpatient model. Evidence shows better outcomes when care is provided early, consistently, and within familiar home, and school settings. The only remaining inpatient has been clinically ready for discharge for 6 months. Discharge is expected by the end of this month, after which the unit will no longer be occupied. And for relevance to Hounslow is, Hounslow providers welcome the shift towards local crisis support, community capacity and improved continuity of specialist care. The borough emphasised the need for clearly defined crisis pathways and strong integration with existing SEND services. And at JOSC, we have a recommendations tracker. And so the committee reviewed system-wide progress on previous JOSC recommendations, items related to workforce pressures, inequalities, hospital redevelopment and mental health pathway reform remain partially delivered, largely due to ongoing financial and workforce constraints. Josh has confirmed its work plan for the upcoming year, but if there is any suggestions for the work programme for this committee would like me to take to Josh, then please do let me know. Thank you.
Thank you, Councillor Sharma. As always, if members do want to take recommendations or speak about it, do reach out. I'm sure Councillor Sharma will update any committee member there. Okay, so we kind of move on. No, thank you for that, Councillor Sharma. So we move on to the next agenda item. So this is the work programme. So agenda item number 7, the work programme review. So we now turn to the work programming. The work programming is the way in which the committee and its panels scope the areas of focus for the year. Everyone here today will have been part of that process last summer. It's an opportunity for the members to come together in the early days of the committee to discuss what should form the basis of the activity across the municipal year. Of course, these things are never set in stone. It is good practice to keep a work programme under review. Indeed, we have adapted our work programme as new topics gain importance and as circumstances change. We will normally consider if there is anything we'd like to add to the future meetings. However, as we approach the final days of the 25-26 municipal year, we have instead an opportunity to suggest topics that the next committee might want to consider when it undertakes its work programme in July. Would any members of the committee like to suggest topics or issues? Councillor Mosley, Councillor Mosley, was it? Okay, Councillor Mosley there. I'll take Councillor Mosley. Thank you for that.
Good to see consistency there. So one of the topics that came out of our discussions around land ownership was around housing associations. I know this has been a topic that the committee has considered many times in the past, but given that it came up frequently during our panel, I'm going to raise it again as a recommendation for future panels to look at. In particular, within the context of fly tipping, it's been a issue that panel members raised in regards to in disputed land ownership or complicated land structures, and what the council can do to make enforcement on those sites. And then further to that is general housing quality and the general issues that the people here will be very familiar with around making sure that there is a high quality of accommodation in the borough in these housing association buildings.
Brilliant, thank you for that. Councillor Mosley, a couple from, yes, Councillor Mosley, thank you.
Whoever, I don't mind. Two quick points for me. Actually following on from the Housing Environment panel, one of the pieces of casework that I get most often is around fly tipping. There's been various different changes in policies over the years towards fly tipping, how we try and tackle it. Raised with me, I'm sure raised with everyone on this panel multiple times a week. I would like that to be a focus, I think, of the not just the future panel, but actually of the future committee generally. If we could have that as a substantive item next year, whatever the makeup of this panel, I think that'd be really, really valuable. And the other point, I was going to make this during the panel section. I make this point every year. Housing and the environment are the two biggest topics, I think, that currently face our borough, potentially our city, potentially our country. To lump them together and to have to choose every year which one we focus on, I think is really frustrating. It might be frustrating for the chair, certainly for councillors, to do one or the other. I would gently suggest, I don't know if it can happen through this committee or not, they're split up and we have one that focuses on the environment, one that focuses on housing, because they're too important to have to pick between every single year.
Thank you, noted. Any other sort of recommendations? I've got a couple myself. So this is, it's really sort of statutory, really activity on the budget and MTFS. I think even so, we do have 3 years sort of settlements. I think the budgetary sort of updates should sort of still continue, just making sure that we're always on the right track. And the future of SEND and youth provision, I would sort of like to see that in future work programs as well. Councillor Roger.
Chair, thank you very much. Just reflecting a little bit on Councillor Elmsley's point on fly tipping. Obviously, the new committee will sort of define the terms of that, but I think we really keen to be as specific on that as possible, because whilst I appreciate it is a regular occurrence in casework, actually the data suggests that we're very successful in collecting fly tipping. And similarly, there is work in the enforcement review around preventing fly tipping as well. So I guess it's just a plea to the committee. If that is something that is taken forward, absolutely happy to do that. But just to really understand what the issue is that you're trying to tease out there. Is it about the casework perception? Is it about the actual response to casework that is reported, and where that kind of balance lies? On your second point, absolutely on budgetary points, very happy to come back here. Very happy to take views on whether coming 3 times a year is enough, whether you want it slightly more regular and smaller, packaged up, whether you want to understand budget proposals in a different way and how you want to do that as well. But very happy to work with the committee on that as well.
Yeah, thank you for that. I think, yes, you're absolutely right there, Leader. It will be sort of a slightly different sort of process to what we've had previously. I mean, Councillor Elmsley, do you want to elaborate a little bit on the fly tip? Is it sort of the strategy or how we do it, or yeah?
Well, I mean, very much up to the next committee to decide how they'd like to define that.
Yeah.
What I would say, I think, there were some interesting proposals in the HE plan around resident stewardship of fly tipping zones. What does that actually look like? What is stewardship? That's one of the questions I was going to ask. That could be something interesting to look at. I think the way that enforcement is carried out in the borough is another one. I know it's outsourced to APCOA, whatever they're called. Yeah, that one, APCOA. So maybe reviewing that as well could be quite interesting. But I think there's a myriad of different avenues. It would be wrong of me to suggest to the next committee specifically where they should go, but I think there's a couple of different topics they could look at there.
Brilliant, thank you for that clarification. Brilliant. Is there any other anything else for the next year's committee to look at? If not, we'll sort of move on then. If there isn't, so it's really agenda item number 9, which is just any urgent business. There isn't sort of any urgent business from me. I don't think there's anything from Leader. Agenda item then number 10, which is the date of the next meeting, which is 2nd of July of 2026. And to that, we draw a close. Or did we not? Yeah, apologies. I've jumped ahead a bit. So it is a forward plan. Yeah. So moving on to the forward plan. I thought I did this, but yes. So the forward plan, yes. Moving on, the forward plan sets out information about decision of council intents to make over the coming months. The committee would normally review the council's forward plan and consider if there are any decisions would like to bring in the future meeting to oversee. As this is the final meeting of the municipal year, this isn't appropriate. Instead, I'll draw the committee's attention to the forward plan and ask if there are any topics you think of 26-27 committee might want to consider. Whilst we cannot direct a future committee membership to act on our observations, we can ensure the suggestions are made to the new committee. So just going back to that review there. So the fly tipping, the casework housing association, and looking at sort of land ownerships there, future of sending youth provision, and statutory activity on the budget and MTF. Okay, I caught that all quite nicely, I think, from agenda item number 8. Thank you. But yes, do I need to continue agenda item number 9? Okay. So yes, we'll jump on to agenda item number 10, date of the next meeting of 2nd of July 2026, and to that we draw this meeting to a close. As this is the final meeting of 25-26 committee, I would also like to extend my thanks to my fellow scrutineers, both here and in the scrutiny panels as well, to all the officers who have supported the work of the committee, and to all our guests, not just today, but throughout this municipal year. The committee will next meet on the 2nd of July 2026. And to that, thank you all very much. Thank you, everyone in this room, and of course, anybody who's watching on YouTube as well. Thank you. Thank you. Bye-bye.